On June 18, the African Regional Commission for Certification of Polio Eradication, an organ of World Health Organization, accepted Nigeria's wild polio virus-free documentation after 30 years. The cheering news was all over the news, but a lot still needs to be done to achieve and sustain the status. That is our focus today on Sound Health. I'm Olasumbo Mudukwe. Welcome to the show. We begin today's edition with updates from COVID-19.
The Nigerian Center for Disease Control (NCDC) has cautioned the public against the use of face shields without face masks because they are not effective in COVID-19 prevention. The NCDC added that face shield is not a fashion accessory and must be combined with a mask to provide significant protection. The agency explains that the face shield protects only the face, but face mask curbs the spread of respiratory droplets. The public is encouraged to wear face masks and ensure it covers nose and mouth with no gaps. NCDC is also announced activation of the Green Experts Lab Kaduna into the COVID-19 molecular laboratory network, bringing the number of labs to 39. The federal government has retained the nationwide curfew declared to curtail the spread of COVID-19 in the country, as well as lifted the ban on interstate travels. Operators can now operate within approved hours. Schools are being directed to reopen for terminal classes, that is Primary 6, GSS 3 and SS3 only, while domestic flights are also to begin operations. Boss Mustafa added that committed to striking a delicate balance between lives and livelihood, President Muhammadu Buhari has carefully considered and approved that with the exception of some modifications, Phase 2 of the East lockdown will be extended for another 4 weeks, that is from 30th June to 27th July 2020. Back here in Lagos, the state government has received a 150-bed extension at the Infectious Disease Hospital Yaba. The donation was made by the Private Sector Coalition Against COVID-19. The state government has also expanded its COVID-19 response capacity with the accreditation of 7 private laboratories to boost its testing capacity and 3 private hospitals for case management. Commissioner for Health, Professor Akin Abayomi, said that the private laboratories were selected through a rigorous accreditation process, and as the state attempts to open up various aspects of its economy, it is imperative that COVID-19 test is widely available to members of the public. 3 private health facilities have also been accredited and approved by HIFAMA for the treatment of COVID-19. The state government will also be transitioning to the phase of community-based treatment and inclusion of home care into the state strategic response. Under the home care arrangement, mild to moderate cases will be managed and isolated at home, while critical to severe cases will be treated at COVID centers. Over 24,000 cases, more than 8,000 discharges, and above 500 deaths have been reported in Nigeria. And worldwide, there are more than 10 million cases, over 500,000 deaths, and above 5 million discharges recorded.
It's still Sound Health on Lagos Television. Nigeria was one of the 4 countries racing to end the polio virus. The good news is that Nigeria is about to get a certification for a polio-free status. Today, Dr. Tunji Funsho, the chairman National Polio Plus Committee, will share his expertise on the country's roadmap to certification for a polio-free status. Welcome to the show, Doctor.
Thank you very much for having me.
Okay, Dr. Funsho is joining us via Skype. Sir, what does the certification mean for the country?
So the certification for the country is a validation of the hard work that has gone on for just 30 years now. 30 years now internationally, but essentially 20 years in Nigeria, in our efforts to make sure that no child is ever again paralyzed by the white polio virus. So we have worked very hard. Nobody thought we would get here before some of the other countries. So at least for now, it's time to pat ourselves on the back, but then start to now work towards keeping ourselves in this status of a polio-free country.
Okay, this is not the first time we got a certification. We did in 2015. What is the difference, sir?
Well, the difference was that in 2015 we were not certified a polio-free country. We were just removed from the list of endemic countries, which is quite different. Now we have certification. The certification with all the necessary documentation by the Africa's Regional Certification Committee that has shown that the possibility of having any white polio virus from any part of this country resurging is zero. That puts us in a new status entirely of a country that is certified polio-free. In other words, the only way that polio can get back into Nigeria is if it's imported from outside the country. And that's a huge, huge difference.
Okay. Does this mean that the country does not have the strain? And was there a final visit to determine the polio-free status?
Well, in the last 6 to 9 months, the African Regional Certification Committee has been going around Nigeria verifying the status of our efforts, looking at documents related to cold room, related to surveillance, related to the quality of staff in the field, and of course ensuring also that our disease surveillance and notification system is robust, not to have missed any case of polio. So they just did not sit down and decide. They did a thorough examination of everything that is on ground and also examine documents that gives insight into the work we have been doing so far to get rid of polio from Nigeria. Is the result of that effort that was multifaceted that led to the final removal of Nigeria as a polio endemic country. So now we are a polio-free country. In other words, the chances of any polio virus in Nigeria is zero. So it's not likely at all that any child will be paralyzed by the white polio virus in Nigeria, except it is imported from abroad.
Okay, the National Primary Healthcare Development Agency Executive Director, Dr. Faisal Shuaib, welcomed the development. However, he assured Nigerians that all actions, particularly vaccinations, would be intensified to avert a resurgence. What's your take on this?
Well, yes, there's very good intention on the part of the National Primary Healthcare Development Agency. And we need to support them as much as possible because, there has been a lot of efforts to strengthen our primary healthcare system in this country. The first, most recent, I would say, was the Bamako initiative, which was an initiative, of ministers of health from all African countries, meeting in Bamako, to look for policies that will help, the continent to improve, his primary healthcare system. And at that time, the hope was that there will be an improvement overall, because that is where national health actually resides. In 2001, we had the Abuja Declaration that of all health ministers again, that made it the target for countries to devote 15% of their budget to health. As I speak, our budget for last year was just 3.9%. It has been marginally increased to, I think, 4.5% in the budget for 2020. We are nowhere near there. So we need to put our money where our mouth is by continually increasing resources that we put to primary health care. We also have the issue of manpower. Without funding, you cannot create the necessary manpower. Thankfully, because of the funds that were expended on our polio eradication effort, we have a huge number of human resources who are well-trained public health physicians and other paramedical workers who can help, but they need to be funded. We hope that this legacy will, transfer from where we are now to all the new measures that the government is setting up to ensure that the primary healthcare center becomes the cornerstone of our healthcare.
Okay, intensified surveillance can help reduce susceptible polio-compatible cases in Nigeria. What strategy will be in place to check reoccurrence if you were to give the stakeholders advice?
Well, the major tool we have is actually routine immunization. That is why I'm stressing on primary health care. The major tool we have is ensuring that every mother or caregiver has access to a primary health care center. We have been doing a lot of work, a lot of documentation. I recall during the tenure of Professor Ransom Kuti as Minister for Health, 85 to 92, he did a lot of work in strengthening our primary healthcare system. When he left office, everything went to sleep, and only in the last dispensation of the Minister of Health, Professor Adewale, that the 10,000 primary healthcare center was initiated. We have not seen much of that right now. And there are quite a number of initiatives like that. There is the current, provisions of Basic Healthcare Provision Fund, which is currently being revised, by the Ministry of Health. We need to be consistent to ensure that we have a robust primary healthcare system that is accessible to a majority of the population who actually require it, because that is where 75% of our healthcare takes place. Within that context, polio eradication will continue to be sustained, and of course, will make a lot of gains for other preventable childhood diseases.
Okay, for a polio virus to be certified as eradicated worldwide, at least 3 years of good surveillance without cases needs to be achieved, though this period may need to be longer for a strain like World Polio Virus 3, where a lower proportion of those infected demonstrate symptoms, or if fewer samples stay positive. What's your take on this, sir?
Well, in our surveillance system, we not only look, for paralysis in children, we also check for the virus in the environment. WHO is very, very adept at doing this. They have sites across the country where they take samples of sewage-related, water, and check it for the virus. We have not seen any virus in our environment for that duration of time as well. So it's a combination of finding the virus in children and also checking to make sure that the virus actually does not exist in our environment. And the best place to find it is in our sewage system. And this is going to continuously be done until the world is certified polio-free.
Okay, we know about herd immunity. When many hosts are vaccinated, especially simultaneously, the transmission of wild virus is blocked and the virus is unable to find another susceptible individual to infect. Vaccination is still a challenge in some parts of the country due to myths and misconceptions, communal beliefs, gated communities during immunization, lack of basic health infrastructure, as well as insecurity. What can be done to surmount these challenges?
I think already, for us to get to the stage we got to, we have evolved a lot of strategies, to overcome some of these challenges. I think one of the major ones actually is to solicit the support, of our traditional leadership. And they have been a major game changer as far as education in this country is concerned. working, through the Traditional Leaders Council, for eradication of polio and other, vaccine preventable diseases. They have continuously ensured that the rank and file in their domain appreciate the need. So it's just a very tiny minority who are holding out, on all fronts, whether for traditional reasons or for religious reasons. But they are so few in number that if we get the majority immunized, because the coverage we're looking for, if you get 90% of children, immunized, against, the wild polio virus, even if the virus come back in the environment, the chances of reintroduction of polio into this country is almost zero. So we have worked assiduously, and that was one of the game changers. Of course, there are other strategies that have evolved, particularly in areas, that we have security challenges of using either joint civilian task force or in collaboration with the military, who in some cases, in fact, go to insecure areas to immunize the children themselves. So those are the kind of measures and collaborations that we have developed, which we can also transfer to other interventions when it comes to health issues.
Okay, as the chairman of the Polio Plus Committee, what next after this?
Well, I believe that right now we need to start refocusing our energies in ensuring that routine immunization is built up, and that children below the age of 2, but more importantly, children below the age of 5 get all their routine immunizations, which includes the polio vaccine. To do that efficiently, the government must provide the resources, but at the same time, people need to be educated. So there's a need to communicate, with the population about the need for immunization and the safety of these if and the benefits in the long term of ensuring that their children are covered by immunization. I think if we do these two things, provide the resource and accessibility to these vaccines and provide the education to drive demand for these services and interventions, I think we'll be on the right road to ensure that we keep polio at zero in Nigeria until such a time that the world is certified polio-free.
Okay, before I let you go, Dr. Funsho, what is your advice? Are there any plans to incorporate or to allow children in the displaced units, internally displaced persons, are there plans to incorporate them into the system for immunization?
Well, as far as I know, currently, all IDPs, have health facilities, most of them run by UNICEF, where children are immunized, where even antenatal care, takes place. And when we also do our supplemental immunization activities, when we go house to house, IDPs are not left out. They are part of the micro planning to ensure that every child below the age of 5, gets the vaccination. So they are not left out at all. They are within the plans for our supplemental immunization activities and also for routine immunization.
All right. Thank you so much, Dr. Funsho, for your time and expertise on today's show.
Thank you for having me.
We have been talking to Dr. Tunde Funsho, the chairman of the National Polio Plus Committee of Rotary International, on how to achieve and sustain a polio-free status in Nigeria. The show continues with trending health reports. Sound Health on Lagos Television. This week, the world observed Post-Traumatic Stress Disorder Day, a mental health disorder that is experienced by few persons after a traumatic event. In this package, we highlight how to cope with the disorder. This is where we say thank you on today's episode of Sound Health. Remember, it takes a collective effort to achieve a polio-free status. Ensure every child gets immunized periodically for a disease-free country. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.